Hello, Dr. Ross Walker and welcome to Miskawaan Cardio. When you think about heart disease, I've said before, all heart disease is genetic. So what puts the muck in the wall of your arteries? So imagine that donut, the fat swelling out this way. What makes it swell out this way are genetic factors. 70% due to insulin resistance, the commonest genetic abnormality in the world. 20% due to lipoprotein delay. 10% due to all of the other less common risk factors that can put muck in the wall. That's what puts it there. But what makes it go? Well, there are 5 stressors or 5 precipitants that rupture a fatty plaque. Number 1 is emotional stress, and please show me someone who doesn't have that. So even something like anger, within 2 hours of you getting acutely angry with anyone, you increase your risk for a heart attack by 8 times. Within 2 hours of you getting acutely anxious about something, you increase your risk for a heart attack again by about 8 times. People who are suffering depression have a 50% higher risk for heart disease. So any acute emotional stressor can rupture a fatty plaque. So think of a plaque like a pimple sitting in the wall. You squeeze the pimple with that stress, it makes the plaque rupture. That's emotional stress. Then there's mental stress. So you're under the pump at work, you're working very hard, that can precipitate a rupture. There was a study called the Whitehall study of 17,000 British civil servants monitored for 20 years, and they found that there was a thing called job strain, which was high demand, low control. So it was in fact the middle managers had more heart attacks and blood pressure issues than the bosses because they were under job strain. So mental stress is very important. Then there's physical stress. Now you've heard me say exercise is the second most important drug on the planet. But what I'm not talking about doing your regular exercise. I'm talking about the fat guy that runs for the bus. That's when you can rupture a fatty plaque. I'm talking about these idiots who climb Mount Everest. It's not just the climb, but it's the freezing cold temperatures and the low oxygen that may rupture a fatty plaque. But it's also the physical stress of chronic pain, the physical stress of dehydration, the physical stress of an operation can rupture a fatty plaque in your arteries. Many people suffer a heart attack when they have an operation for something else. Then there's pharmacologic stress, legal or illegal stimulants. So for example, you have a couple of cups of coffee every day, it's good for you. But if you have 6 a day, it increases your heart attack risk by about 20%. You might drink a glass or 2 of wine every day. That's what I call just being civilized. But you might go out one night and have 7 or 8. That may rupture a plaque in your arteries. I had a fellow in his 30s that went out for a bucks night one night, strong family history of heart disease, had a few lines of cocaine, major heart attack. So any legal or illegal stimulant may cause or precipitate a heart attack. And then finally there's infective stress. In these days of COVID, we're finding people who get severe COVID, 50% of them have some sort of heart problem, including an increased risk for heart attack. But it doesn't have to be COVID, it can be influenza, it can be pneumonia, it can be a tooth abscess, it can be a urinary tract infection. Anything at all that inflames your arteries may also precipitate a heart attack. So what puts the heart disease there in the first place is genetic. What makes it rupture is one of those stressors.
Miskawaan, Visionary Healthcare.